Another of Dr. Vora's specialties is revisional surgery. Doctor, what really is revision surgery?
Revisional surgery is really surgery where patients have had a successful bariatric operation and now have some weight regain or recidivism. What we want to do is get them back on track. Certain group of patients who've had a gastric bypass may have stretching of their pouch or stretching of the connection between the pouch and the intestines. So what we can now offer for them is an endoscopic procedure called the StomaFix, which can sort of, by imbrication, narrow the pouch and bring it back to its original size. And that will then again hasten their pace of weight loss. We also offer revisional surgery for patients who have had a stomach stapling procedure done, and that came apart. We're now able to convert that to either a gastric bypass or a sleeve gastrectomy. On occasion, when patients have had a gastric band and the band had to be removed for some reason, we're then able to offer revisional surgery and convert them to different surgical procedures like a gastric bypass or a sleeve gastrectomy.
You referred to endoscopic procedures. What is that?
Endoscopic means everything is done through the natural orifice. So we're able to accomplish the procedure without any incisions. We basically put an endoscope down and then are able to do the procedure entirely through that modality. We go down the patient's throat into their stomach and then are able to perform the procedure all through the endoscope. This way, when the patients wake up, they really have no discomfort. It's really like getting an outpatient endoscopy done. They're able to go home the same day.
Explain what StomaFix is. That's something else you do.
Stoma refers to a connection, and fix meaning fixing it. So you're basically restricting the size of the stoma, which is the connection between the pouch and the intestine. StomaFix is essentially an endoscopic procedure we offer to the patients who have had a gastric bypass and have had some weight regain. So what happens is that the pouch will stretch, or the connection between the pouch and the intestine will stretch. So with a StomaFix, we're able to do it all endoscopically, basically imbricate and reverse the pouch back to its original size. This way they're able to have the benefits of the weight loss again.
Under what conditions would a patient be a candidate for this revisional surgery?
We are obviously selective in the group of patients who we want to offer the revisional surgery. So we want to again demonstrate that the patient is motivated, they had a bariatric procedure done and then had some weight regain or had the procedure reversed for some reason. We want to be able to offer them a second chance at the weight loss. So we're selective and want to demonstrate that the patient has the same level of motivation prior to offering them a revisional operation. The vast majority of weight loss doesn't happen overnight. It's a very insidious process. You gain 1 pound a month, it's 12 pounds a year. In a decade, you can easily put on 100 to 120 pounds. So I think it's very important to be regimented and have a target weight and try to maintain it within a few pounds of that.